When you look up disseminate in the dictionary, you get the following definition: to spread or disperse something, especially information, widely. Now, this description is pretty straightforward, but when discussing scientific dissemination, the definition fails to cover the words, shall we say, essence. To fully discuss what scientific dissemination really is, you must look at the importance of scientific communication, the development of such a discipline, and perhaps the relationship between science and art. Now, much like anyone looking to be recognized in their field of study, researchers aim to be published. And why wouldn't they? Why bother conducting research if not to share it with peers and colleagues? However, informing other scientists is one thing. Educating the general public, that's something else entirely. Yet, disseminating research beyond the scientific community arguably holds the same importance, if not more. I know, I'm sure everyone is wondering, but why? Well, having these academic discussions between scientists is important, as it leads to different perspectives. But these discussions don't necessarily result in change. What we need to bring about that change is to simply get the raw, hard science out there. So, beyond peer publications, researchers have an obligation to make sure that their findings are heard and understood by the people. Not to mention that taxpayers fund much of the research that takes place. So it's only fair that we know how our money is being used. And this is where we come to a problem. How must everyday individuals seek to understand the mounds of scientific lingo that come along with 30-page research papers? All the quantitative data in the form of graphs and charts? How can all those statistics and descriptions, all that analysis, be digestible to those outside of the scientific community? Well, that is where the arts come in. And to clarify, yes, I'm talking about creation in the most general sense of the term. The work done by filmmakers, writers, storytellers, and photographers, to name a few. Even the art of communication, taking action through social media or organized events like this one. Artists can help scientists reach the people. And as much as our society would deem the arts and sciences as two distinct disciplines, they have in fact always gone hand in hand. Take, for instance, the anatomical drawings by the Renaissance master Leonardo da Vinci, or the illustrations of the Metamorphosis of a Butterfly by Maria Sibylla Marian, dubbed the woman who made science beautiful. Are these science? Are they art? I would argue they're both. Science provides the facts, while art brings those facts to life. Thus, when it comes to scientific dissemination or communication, the sciences and arts can be interwoven. This is how we reach and relay a message to a broader audience, the public. So today I would like to share with you a particularly powerful example of this, a rather new dissemination technique that bridges together the hard sciences and theater. It's called ethnodrama. In simple terms, ethnodrama is the written transformation and adaptation of ethnographic research data into a dramatic play script staged as a live, public, theatrical performance. The main goal of ethnodrama is to provide information in a meaningful way, to inform, engage, and entertain, all the while remaining authentic to the research and providing a voice to the studied community. You might still be asking yourself, why is ethnodrama the right tool? Well, through theater or theatrical techniques, healthcare providers may better understand and therefore cope with issues in practice that are complex, interpersonal, emotional, or multifaceted. Researchers need to not just focus on developing new medicines or new technology. They need to take into account considerations like the needs of their patients, barriers of delivery, and resource constraints in the areas that they are serving. Our complex healthcare environment demands a nuanced approach. I was first introduced to ethnodrama this past summer as a global health intern at UCSF. Working alongside one of my mentors, I helped create a project that I never could have imagined. As naive as it was, I went into this experience thinking that I would be working in a lab, observing things under a microscope, and compiling data into an Excel spreadsheet. Yet, just on that very first day, my understanding of scientific research changed. Much like many of you, I had no previous knowledge of ethnodrama. But listening to my mentor speak so enthusiastically about this non-traditional approach piqued my interest. So I spent the next couple of weeks combing through over a dozen transcriptions of patient interviews detailing neonatal morbidity in clinics across sub-Saharan Africa. The research mainly focused on analyzing a select group of young women's understanding, or lack thereof, of the events surrounding the death of their newborn babies. By summer's end, I had written 3 monologues, which were compilations of the stories that I had read. And today I would like to share one of those monologues with you now, performed by a fellow international high school senior, Kimmy Smith-Dahl.
I just have a feeling the doctor was in a hurry to help other mothers deliver because maybe they were being paid. That's something I thought to myself. After I delivered, he just brought the baby over to me and dumped him on my chest without bothering to take a closer look to see what might have been wrong. You know, the moment you see something amiss with a newborn baby, you should take the initiative to handle the case before you just move on to the next one. I didn't like the way the doctor just dumped my son on me like that, like he was some sort of rag doll. I didn't feel it at the time, but later on when he started to have complications, that's when I recalled and thought maybe that could have been the cause. He didn't even cry like all my other children had done when they were born. A little while after I delivered, I heard the nurses say that he had a problem. He tried to vomit several times, and I could feel something wrong with his breathing. He was just exhausted. When I was first admitted to the hospital, I felt horrible. My neighbor told me, just relax, don't give up. You can see there are so many people here with children. What makes you think that yours has any more complications than the others? The nurses tried to tell me that I should stay back at the hospital. The baby wasn't breathing very well, but I couldn't. I had left my other young children back at home all alone. I needed to get back to them and take care of my new baby. The doctor tried to do something at the last minute, but it didn't work, and my baby died. When my husband came to find me, the doctor had already left, and I wondered, why would he escape the moment he saw my husband? What was he running away from? After my son passed, I told my family that it had already happened. There was no need for commotion. My husband, of course, was still upset and said, if only I found the doctor, I would have strangled him. I told him that he should just let it go. I am sad, I'm devastated, but I know that it was meant to be. He would have died even if they had cut the cord right away. I found consolation in the fact that God has his own plans, and I can never stand against them or blame him for them.
What you just saw was a non-interactive ethnodrama. This would typically be included as part of a larger show, presented in a medical school classroom, a research symposium, a community clinic, or to whatever audience might benefit from this experience. This would serve as a springboard for discussion, where the audience would then have the opportunity to reflect upon the production and say, a post-performance dialogue. Now, understanding the significance of qualitative data can be cumbersome unless analyzed appropriately. Ethnodrama is here to make that process user-friendly to the consumer. As a producer or playwright, I must present to you the material in a dynamic and interesting way that doesn't just go in one ear and come out the next. So don't worry, I'm not asking you to read through 72 pages of transcriptions. That's my job. Through the process of creating a script, there's this unique potential to interpret, translate, and disseminate research findings. So we must acknowledge this modifiable aspect to the design. By adhering to practical considerations, we're able to make changes in how to go about the process of data reduction, characterization, the role of the researcher in the production, and the safeguarding of the participants' privacy. In creating the script, I would string together many interviews, looking for the common points, the threads that will ensure that the audience will remember. Each individual interview may have been long or meandering, but through this analysis phase of the research, I am able to drill down on certain elements, identify poignant passages or reoccurring themes that can later come together to amplify a unified message. In ethnodrama, we can and must also accentuate key details, like the interview subject's language, mannerism, or tone, in order to again give a voice to the subjects and to emphasize key moments. Now, we are creating characters that are fictional composites, but they still respect the collective realities of the original sources, no matter the writer's perspective. And as much as possible, we strive for a natural sounding dialogue, avoiding anything that might seem out of context or contain unnecessary or uninterpretable academic jargon. I would like for you to think about the complexity of the stories. This might be restricted by short running time, like you saw, limiting the number of characters or the depth of development. So there's this sort of trade-off that needs to take place. Nevertheless, for the end result, the audience will witness a recognizable experience, a universal trauma rooted in a particular context. Depending on the audience member's perspective, the story might seem strangely familiar or completely unimaginable. Either way, the play will elicit strong emotion, and that is what makes research memorable. So before I go, I would like to present you with one last thought. Imagine you're CEO of a venture capital firm, and you're tasked with finding research worthy of your philanthropy. You're reading through a bunch of graphs and charts and paper one after another, when all of a sudden, there's this more enticing option. A video of an ethnodrama. You pour yourself a glass, watch a 2-minute clip. The actor is engaging. The topic is raw and personal, and you identify with it. You think about being a parent, losing a child, and in this case, that something could have been done to prevent the tragic outcome. How could you not want to fund that research? You pick mine out of the pile. That is the power of ethnodrama. Thank you.